Okay, welcome. I'm here with another Graduate College of Social Work alum, Casey Malish. I'm going to turn it over to you, Casey. If you could tell us a little bit about yourself, when you graduated from the program, and what your job is, and what you do kind of on a day-to-day basis pre-COVID-19, what your job was like.
Thank you. Yes, my name's Casey Malish, and I graduated from the GCSW School of Social Work back in December of 2019. A little bit about me. Part of the work I do today and everything is I'm a harm reduction worker. I specialize in needle exchange, as well as HIV and hepatitis C and overdose prevention. I first got involved in that work while at the GCSW, really involved with it there. I did some volunteering in Austin for it. And then as I came here, I remember we had an assignment one time and they had asked us, I can't remember exactly the details. This was like my first semester in the GCSW, and they had asked us to write about something and why it, and kind of like defend your point on it. And it had to be real quick. And I remember I wrote it, presented it to the class, and one of the professors was saying, like, yeah, this is something you're really passionate about. And it didn't even really dawn on me until I was like, was I really that passionate about it in my first way? But I guess I was, and I kind of thought about that, and I was like, you know what, it is actually. And I just saw there was a big need for it in Houston, and it wasn't really getting addressed here, and just Texas as a whole, really. Austin has one, but it's been, I think, since the 1990s or so, they've kind of agreed to just allow it to happen with no police interference. It's still not technically legal, but we've been
technically legal?
The needle exchange in Austin isn't technically legal. It never really passed through. Like a bill never really passed, I don't think, for it as far as I know, but they've still allowed it to continue, even so. So what I've been starting to do today is I'm a full-time outreach worker with AMA, Association for Advancement of Mexican Americans. And that was my last internship that I had while attending U of H, and started to work with them after. And it parallels really well with the harm reduction work, in that I'm engaged in a lot of HIV and Hep C testing, as well as, and a lot of those people who we engage with happen to as well be users too. So are people who are experiencing substance abuse intravenously, who I'm then able to provide services to from there. And it's not just syringes now. As things come along, the smoker kits are something we're starting to utilize more to prevent people from sharing a pipe of any sort. Really, it doesn't matter what drug's being used, just to prevent the spread of germs that way. And hopefully, if we can, put some kind of slowness to spreading of, say, coronavirus, for example, to people who are also experiencing substance abuse by smoking.
Okay, good. So how has your job changed now in response to the pandemic? What are you working on now?
So now it's mostly just deliveries, and of course having to be cautious when you do that too. Mm-hmm. But we still are taking phone calls, and we still will deliver or have people come by close to me is really preferable.
Deliveries, just so people understand, what are you delivering?
We will deliver clean syringes, Narcan, overdose reversal medicine, fentanyl test strips, so people can test their drugs to determine if there's fentanyl in them, as well as sometimes tourniquets, so people can be able to successfully inject without missing and causing arm abscesses and arm infections, which can result in hospitalizations, and as well as sometimes sterile water, if we have that available too, for them to use. So just trying to make sure people are still supplied with that during this time. But for the most part, our street distribution, if I do any of that, it's just taking place by car. and I'm just driving around rather than walking, and maybe I'll pull over. And I haven't been doing nearly as much of that lately, though, just kind of out of respect to the community and out of respect to myself.
So the services haven't necessarily changed, it's the methods by which you're having to deliver them. It sounds like that's changed the most.
Yeah, I would say so. Yeah, that's the most.
And what do you have access to protective equipment like masks, other things? And
I do, yeah. I do from my work.
Okay.
Yeah. So I do have gloves and I have a mask with me, and I'm sure I can get more if needed.
Mm-hmm.
But the whole landscape is certainly changing amongst the people who are actively experiencing substance abuse right now.
Right. How have you seen that? What's changed?
So what I've talked with one person about is it depends on kind of what we're talking, but in terms of like methamphetamines, for example, stuff can be harder to obtain from the store that you need to make it. So the price is going way up for it. Also, I think just the general kind of sense of fear about delivering to people is making it kind of, you're having to sort of make it more worth people's while. So they're starting to become increasingly rare to find, and the prices are going way up as well. And people are starting to be charged more for it. We know that the behavior that often comes along with it, the risky sexual behavior and everything, is changing a lot to video and online type of stuff. Sexual behavior in that regard that's oft commonly goes along with methamphetamine is decreasing and taking other routes of taking place, while the price of it, though, however, continues to go up higher. Right. And the risks associated, because of course no one wants to get pulled over, right, and singled out and everything. And in terms of the opioid market and the heroin market, that's, from what I've heard, it's a couple concerning things. And one is that it's been drying out, I've heard, and that could possibly be due to closed borders and due to the fact that we're not seeing, we're seeing a lot of different cities and states, having stricter guidelines on driving and checkpoints and everything. So while it might come from one place to another, not wanting to take that risk involved with delivering, which also leads to people probably higher seeking out medication-assisted treatment. And we know some places they're having a real problem with that because of the overcrowding, and then trying to keep the social distancing as well. And sometimes people are kind of like, I'm not going to wait in this line. This isn't worth it. It's too much. From everyone we've talked to in Houston, they're still providing services and taking new clients for medication-assisted treatment. But we do know that it can cause overcrowding, which can lead to other problems and can lead to just potentially a higher rate of relapse as well for people who are stable on methadone, just because of not wanting to wait all day and night and to possibly not even get served.
You talked about prices going up of substances and perhaps lack of access. And I could anticipate some people thinking that's good, that will reduce substance use. But what are the real impacts of that to the people that you're working with?
I think the real impacts of that are, you could potentially see increased burglaries. You could see potentially increased theft, or increased, possibly trying to increase dealing on the hands of people who are maybe just users usually, to try to continue supporting themselves. While so you could see an uptick in arrests. You could see an uptick and some kind of activities that might be deemed as illegal, which of course is something that can happen. Doesn't necessarily, I haven't looked too far into that as of now, but that's kind of my guess at what you could possibly see from it. Also, a lot of people who I guess one good, like, it's something that could come out. Maybe they do start seeking out treatment or detox, and seeking inpatient treatment as well. just to have a place to, or a detox facility, just simply as a means to have a place to go to not be in withdrawals from.
I was thinking there could be a health consequence though too, if people are addicted to a substance and they're not able to access it, but then if the medication assisted treatment isn't available, there could be a real health consequence to them, right?
There could be, absolutely. Yeah, there could. And I think a lot of that too comes down to just the lack of access to syringes right now also. And I think that's kind of where a lot of the health consequence comes in. What we've seen that's particularly disturbing amongst some people is they're nervous about people coming into their apartment. And these are people who distribute syringes and allow people to consume drugs in their apartment and reverse many, many overdoses. And the real health consequence that I see there is with them being more worried about contracting the virus, that they maybe not allowing as many people to their apartments, meaning less syringes are being distributed, meaning less the people are maybe more likely to go use on their own, or they're likely to continue reusing syringes, which in turn could lead to upticks in HIV, Hep C, as well as overdose-related deaths.
Right.
And that's a really worrying thing.
Yeah. So it's what I've been thinking a lot about is that when we have crises like these, and I think for those of us who were in Houston during Hurricane Harvey, we saw something similar, that this kind of crisis often exposes some of the bigger inequities we tend to see in society. How have you seen that play out in your work?
Well, in particular, some harm reduction coalitions aren't deemed as an essential service in certain places around the U.S. So with that happening, if they're not seen as essential, then people are risking getting in trouble by going out and providing the services anyway. And I think what else is that, of course, overdoses aren't being talked about right now, but we know that right now more than ever is important for people to have access to Narcan, because that's something that could be responded to very slowly. And, our people may not respond, emergency personnel may not respond to it at all because they have so much other stuff going on right now. That we're seeing.
Can you explain what Narcan is just quickly so people know?
Oh, yes, of course. Narcan is a overdose reversal drug. It's an open carry. Anybody can carry it. It's very easy to use. There's an intranasal one as well as an intramuscular one. And it kicks the opioid, basically kicks it off the opioid receptor in the brain, allowing the person to be able to start breathing again if they're sedated to the point that they're not breathing.
So access to that could be restricted during a time like this?
Yes. And that could be strictly, from a pharmacy standpoint, like people who sell it in the pharmacy, it's very expensive as it is. Okay. So it's very hard to come across there. So the lack of knowledge that there's free Narcan in Houston is one thing. And then just, I guess it could be the more strict rules we're seeing in pharmacies and everything could be another too. And we know that with this whole pandemic, that the overdose epidemic is continuing as well. So it's very important right now to make sure people have that access to that while all this is going on, because it's, something that, people probably aren't going to go spend money out of pocket to go buy.
Right. So I've been thinking a lot as you've been talking and kind of throughout this whole pandemic about opportunities that we could be looking at, thinking in a macro sense. What are some of I'm hoping that this crisis kind of gets people to expand our moral imaginations in a way that, are there different ways that we could address challenges we face in society post-pandemic so that we see less of these inequities, so we treat people better, so that we recognize people's humanity in a different way than we've seen before? what can happen with the or what would you like to see happen differently post-pandemic with the population that you work with that could lessen some of these inequities?
Um, I think for me, I would like to see a little less of I think there's kind of like a stance a lot of people take that's kind of you gotta let, which is true to some degree, but where it's like you gotta let them hit bottom on their own,
Mhm.
and you can't be there for them because that's enabling. And I think there's kind of a fine line between caring and enabling that's easy to get blurred together. And I think it's just important that people know, considering how widespread substance abuse currently is, and that people are likely to know someone who's impacted or know someone who knows someone who's impacted, to let them know that there's stuff available no matter where they are, kind of meeting them where they're at, whether they're ready to stop, they're not ready to stop, then showing them you care about them by providing them the resources to be the safest possible while they're still in whatever place that they're currently in that moment. I think there's needs to be I'm active in the rooms of 12-step recovery as well. And I would like to see amongst them more open-mindedness on medication-assisted treatments and other routes that people decide to take, and not discriminating people based on whatever they choose to be their method of recovery, because I think that shame and that stigma can often drive people away from recovery in the end, and maybe even put people off of it long term by saying, I'm not going back to that place because I was judged. Even if they're off the medication, it's still, I was judged so harshly at
Right.
that time in my life. So I think it's just, sorry, I'm moving. There was a lawnmower outside my place. I think it's just an acceptance of, meeting people where they are really, and trying to see how we can help, and seeing this as a collective thing. And that's kind of like I talked about the safe smoker kits earlier, as well as syringe. We're all in this together. So one person passes coronavirus from a shared pipe, it can get into, next thing you know, people not smoking or not living in a particular area are impacted all over. So it's something, same with the HIV and Hep C, it's something that starts at one person but can expand to impact many.
Right, right. What about at the policy level? If the pandemic's exposing things like lack or shortage or difficulty accessing things like Narcan or needle exchange programs or medication assisted therapy, what would you like to see at the policy level so we wouldn't see that, say, the next time there's a crisis like this?
At the policy level, well, I would think first and foremost would be considering syringe access and overdose prevention an essential service,
Mhm.
or considering harm reduction an essential service during times of crisis. I would like to see possible, I would think more funding available for medication assisted treatments. While the methadone route is usually cheaper than the Suboxone route, for example. Maybe kind of breaking down those barriers, and really seeing, one thing we're working on right now is trying to bridge the gap between the jails and medication assisted treatment.
Okay.
And so, for example, if somebody's taken in, whoever they're meeting with, somebody who works within the jail system can go as far as to offer them that route and even set up an appointment for them while they're in there. Now, if the person decides to go upon release, is entirely up to them,
Right.
but it would at least set up that option for you have somewhere else to go when you get out of here. It doesn't have to be, necessarily to pick up illicit drugs. You can go get medication assisted treatment. We have other forms of help
Right.
for you. So trying to really bridge that gap is something that's been important to me lately.
Okay, so last question. What could people do to help if they're interested in helping the population that you serve? Kind of recognizing our own limited abilities to leave our homes for our own safety. What can the broader social work community do to help?
I think spreading awareness is probably the most important thing. And that can come in, a lot of times I'm out and people just aren't simply aware that there's state-funded detox facilities available. There's state-funded rehabs available. They think it's kind of like, I don't have insurance, I'm screwed kind of mindset. I can't do anything.
Mm-hmm.
And letting people know that that's available. But also a lot of times when I'm doing distribution, it's like, I had no idea, they have no idea this is available, that the Narcan's available, the syringes are available. It's, or the medication assisted treatments available. It's just letting people know that no matter where they are right now, that there's a resource available for them. I think something amongst the GCSW, for example, can be like we talked about earlier, partnering with the pharmacy school to provide the knowledge of Narcan and to be available for free through the pharmacy, but also developing a resource guide from there,
Right.
for example, or something that can be used for students who come obtain it. Like, oh, take one of these while you're at it too. This has all the available resources from inpatient treatment all the way to harm reduction.
Right.
So people can spread more awareness about what's available for them.
Okay. Well, thanks for joining us today, Casey. I really appreciate it. I think this is a population that sometimes we can forget about. Not just during a crisis like this, all the time. So I'm hoping this raises some awareness, but particularly about some things we need to be thinking about now. So I really appreciate you joining us today.
Thank you so much. I appreciate you inviting me.